Hi, everybody. I want to talk today about fasting insulin and if it's a useful test. There are a lot of companies out there online in which you can get a variety of blood tests. Function Health, very popular, Superpower, HealthSpan, and many others. And one of the tests they're offering is a fasting insulin level. So I want to talk today about whether that's a useful test or not. What does the evidence show? Intuitively, it makes sense because type 2 diabetes is driven by insulin resistance. That means your body has to make more and more insulin to maintain a normal blood sugar level. And so the thinking is that your insulin level actually increases possibly before your blood sugar level increases. So it might be a better predictor of future problems. What does the evidence show? So one problem is measurement accuracy. The American Diabetes Association looked at this and got together a working group, and they looked at 12 different laboratory assays, and they found a high degree of variability both between the different lab tests and within the same lab test. One of the challenges is hemolysis. Insulin measurements are very sensitive to hemolysis, which is when red blood cells break down while your blood is sitting in the test tube waiting to be processed. Another challenge is a lot of the assays that measure insulin also cross-react with proinsulin, which is an insulin precursor. And so while it's giving an insulin reading, it's actually giving an insulin and proinsulin reading, which could give you an artificially elevated insulin measurement. There also isn't consensus on what an abnormal insulin level is. Different groups have argued for different cutoffs. So let's put aside the inaccuracy and the disagreement over what's normal and abnormal. And let's assume that we have an accurate lab test and we all agree on what an abnormal insulin level is. Does that insulin level add predictive value towards development of diabetes? And a couple groups have looked at this prospectively, which is when you follow patients over time and see who develops diabetes and who does not develop diabetes, and try to look at which tests at baseline were predictive. There was a study conducted by Wilson et al. As part of the Framingham Offspring study. They looked at 3,000 patients followed for 7 years. You have a group out of Netherlands, Caroline Roderick, that looked at about 1,350 patients followed for 6 years. And both of these groups reported that a fasting insulin level did not add predictive value for the development of diabetes beyond traditional risk factors. So what do our guidelines say? The Endocrine Society published some guidelines in 2017, and here's what they said. Quote, many clinicians measure insulin values thinking it adds to the diagnosis of comorbidities. In fact, it does not, and such measurements are not recommended. In 2023, the American Diabetes Association published guidelines and recommendations for laboratory analysis in the diagnosis and management of diabetes mellitus. Their recommendation, quote, in most people with diabetes or risk for diabetes or cardiovascular disease, routine testing for insulin or proinsulin is not recommended. So let me be clear. I'm not saying that insulin resistance and hyperinsulinemia is not important. In fact, it may be one of the most important factors causing reduced health span and reduced lifespan. But measuring insulin levels may not be that practically useful. It may be more useful to look at the features associated with insulin resistance, which include elevated blood pressure, elevated triglycerides, low HDL, obesity, elevated body mass index, increased waist circumference, fasting blood sugar being elevated, elevated hemoglobin A1C. All of those things may be more useful than measuring a fasting insulin level. So to those companies out there that are looking for biomarkers or other alternative tests to predict health, I would encourage them to find biomarkers that are better validated, more consistent, and more clinically